My name is Casey Overstreet, and this is my informative speech on why some people are more vulnerable to substance use than others. The Substance Abuse and Mental Health Services Administration, better known as SAMHSA, highlights a National Survey on Drug Use and Health's 2024 multi-module data collection of surveys, which were completed either online or in person. This showed that 48.4 million people in 2024 alone reported having a substance use disorder within the past 12 months. What makes someone more vulnerable to substance use disorder than another person? Biological, environmental, and psychological factors play key roles in an individual developing substance use disorder. I have personal experience with addiction with my own past struggles. I am also pursuing a degree in psychology to become a drug and alcohol counselor so that I can better understand substance use disorder and help those who are struggling with addiction. The ideas throughout this speech will give the audience insight on why so many people deal with substance use disorder and what elements influence substance use disorder. There will be three main points throughout this speech that entail the biological factors that contribute to substance use disorder, the environmental factors, which include childhood abuse, the psychological factors that contribute to the disease. Though genes are not the sole contributing factor of whether an individual will become addicted to substances, the National Council on Alcoholism and Drug Dependence just this year has stated that genetics make up 50% of the risk factor. There has not been a specific gene found that a parent passes to their offspring that contributes to substance use disorder, but when there is a parent who struggles with substance use disorder, that causes the child to have a greater risk in developing substance use disorder themselves. Genetics is only one of many contributing factors that make an individual more vulnerable to substance use disorder. But this information opens the door to know what to look for when taking preventative measures to deter people from addiction later in life. Along with biological factors, an individual's environment aids in their vulnerability to substance abuse. For those who are not familiar with adverse childhood experiences, or known as ACEs, this is what the American Psychiatric Association Foundation defines as events that take place before the age of 18 that have the potential to be traumatic to the individual child or adolescents. ACEs have been found to contribute to adverse health outcomes later in life. Brokoff and Associates, who all have backgrounds in mental health and research development with the Norwegian University of Science and Technology, conducted a study in March of 2023, which found that adults who had any type of adverse childhood experience have a 4.3-fold higher likelihood of developing substance use disorder. This data was collected from 8,199 adolescents who were first assessed for adverse childhood experiences between 2006 and 2008. The follow-ups on these individuals was collected 12 to 14 years later through the Norwegian Patient Register, which showed data on substance abuse diagnosis. There is an array of environmental factors that play a role in an individual being more prone to a substance use disorder diagnosis later in life. But this study, alongside many others, has found that adverse childhood experiences are a major contributing factor when it comes to looking at the environmental aspect of the development of substance use disorder. Just in this one study, it shows how prevalent substance use disorder is for those who experience trauma in childhood. Keeping childhood trauma in mind, we will now touch on the psychological factors that play a role in those who are more vulnerable to substance use disorders, primarily how mental health disorders contribute to the development of substance use disorder. It is widely known and accepted that more times than not, individuals are diagnosed with substance use disorder alongside a co-occurring mental health disorder. Bellafiore and colleagues from the Association of Psychoanalysis Applied to Clinics, Research, and Teaching reviewed studies conducted between 2022 and 2024. Their findings showed that PTSD is frequently found in comorbidity with substance use disorder. This research also found that those with PTSD adopt drug use as a coping strategy to alleviate their symptoms. In looking at the psychological aspect of people who are more vulnerable to substance use disorder, this study shows that unchecked mental health disorders contribute to an individual's vulnerability to addictive characteristics. Through the research and studies mentioned in this speech, it shows how prevalent biological, environmental, and psychological factors contribute to those who are more vulnerable to developing substance use disorder. Genetics and biology account for 50% of the risk factors for developing substance use disorder. Research data shows that adults with a history of ACEs have a 4.3 times higher chance of substance use disorder. Mental health conditions increase the chances of an individual abusing substances. If 48.4 million people reported struggling with substance use disorder in 2024, then this information on why some are more vulnerable than others will help guide our understanding of the dynamics of substance use disorder and how truly complex the issue is when it comes to biological, environmental, and psychological components. Thank you.